My name's Abigail Heying, and I'm here to talk about Zebra technologies today from a customer perspective and from an end user perspective. So my background is in bedside nursing specifically, and I work on mostly oncology units, specialty units, ICUs. And so one ways that I've used the Zebra technologies, I've actually used it for multiple EHRs at multiple facilities. Functionalities are very similar though, but a couple of things that I want to highlight that really made a huge difference in my everyday practice. One big thing is the messenger application. So it's actually PHI-coded, so that way you can send patient information safely through this messenger. You connect with your providers, your fellow nurses, and your entire unit. So I know for us personally, I would get on the unit every day, and our charge nurse would make a group chat with all of the nurses that are on the unit that day. So that way, if you ever needed help, assistance, or if you're in a room specifically it's in isolation or need special precautions, you don't have to garb out, get out of the room, go find someone else, go chase them down, try to get some help. You can just message in the group chat and say, hey, room 56, I need an extra med, or I need an extra set of hands, or something's going wrong here. And you've got nurses out your beck and call right then and there, someone to come help you. It really does decrease nursing workflows, it increases communication. So that's one of the big factors. Another thing about it is you can connect with providers. So messaging your provider is so much easier than trying to track them down or page or call them, because pagers don't always work that accurately. So this way you know your provider received your message and they can just message you right back. You can also send them pictures. A big thing in nursing is being able to communicate what you're actively seeing. So tracking wounds, things like that. I'm able to go ahead, take a picture for a provider, and picture goes straight into that patient's chart. Also PHI safe. So that way you don't have to worry about sending pictures on your personal devices, because that's not allowed. So that way, no concerns there for the patient or for the provider. Another big thing is you have the Connect Nursing app here. This really has your entire patient's chart right at your fingertips. The reason this makes such a big difference for my workflow is I can walk straight to my patient's room, see everything I need to know about the patient right at the top, how old they are, their name, any allergies they might have, their most recent vital signs. And a reason that's so big for me personally is as an oncology nurse, I really do need to see their most recent vital signs before I give any medication, anything at all. You can review all that your patient needs to get right here on your MAR. So that way too, you can walk right in, see what medications are due for your patient, double check it, and you can actually just go to your medication administration and go ahead and scan it straight from your phone. So you don't need to bring in your computer, you don't need to bring in a WOW, you don't need to bring in a scanner, you have it all right here on your one device. And that makes such a big difference, because for a lot of these patients, you don't have the space to bring in a huge computer because they've got IV pumps, you've got the patient in bed, you don't have the space to bring in some big computer. You have to use a device like this to be able to really be active and be the most efficient that you can in your practice. Whenever you have a high patient load or high acuity load, you need to be moving quickly and accurately, and this really is the best way to do that. So that's something that's big. You can also print labs from this. You can see what labs are due, and you can collect them straight from your phone right here. Collecting accurate labs is such a big deal because we're gonna type and cross, we're gonna cross-match blood. We're gonna do so many things with these labs that we need to be able to stand in front of the patient, scan the patient labels, scan the patient themselves, print labs, collect them, and walk out and send them. It really does make your workflow so much more seamless. We can also give blood from this device. That's nice too, because your blood brain protocols are really strict. And so being able to scan all of your different labels right from your device makes the biggest difference, because it makes a 10-minute process more like a 2-minute process from this device. So overall, really in every area of workflow, this device can really improve efficiency. I would also like to just highlight this panic alarm on the back. Right now, patient safety, patient or nursing safety is so important. There's a lot of big issues with that. And so this panic alarm will send out to the rest of the facility, the rest to your unit, to let you know that you need help. Whether it's you personally, whether it's your patient, this is gonna send someone directly to you. It's gonna let everyone else know that it's sending out an SOS. And it does work by GPS, so they can also track you. So say they can't find you, this is gonna tell them exactly where you're at. So even if you're somewhere nobody can see you, it's going to be able to find you. So overall, made a huge difference in my practice. Would highly recommend.